Which are the science-based supplements that actually work for anxiety? Let's start with number 5, Passionflower. Not the tea, the standardized extract. And this distinction matters a great deal. Passionflower works on the GABA-A receptor in your brain. This is like your brain's primary braking system, the same system that benzodiazepines like Xanax and Klonopin target, but without the dependency, the brain fog, or the withdrawal. Here's one of the core problems with chronic anxiety. GABA, your brain's main inhibitory neurotransmitter, gets dysregulated over time. It's like the brakes wear down. Your nervous system stops distinguishing between a real threat and a quiet Tuesday night. Passionflower helps restore that tone without forcing it, not just pressing on the brakes, but rather repairing the brake line that's been fraying for years. In a head-to-head clinical study, Passionflower extract performed comparably to oxazepam, a prescription benzodiazepine for generalized anxiety, with significantly fewer side effects. I use this especially with patients whose anxiety spikes in the evening or wakes them at 3 a.m. If your worst anxiety hits when you should be unwinding, that's a GABA dysregulation pattern. That's exactly what Passionflower addresses. The above-ground parts of Passionflower are the useful parts. When it comes to quality, Passionflower products vary significantly. Registered herbal medicinal products are more reliable than food supplements, with one recent analysis finding that 5 out of 6 fail to meet specified content and identity standards. Dosing recommendations for Passionflower vary by formulation and indication, but typical ranges are 250 to 500 milligrams of dried extract or 0.5 to 2 ml of tincture taken 3 times daily for anxiety or as a single dose before bedtime for sleep. The most common side effects appear to be dizziness, confusion, sedation, and ataxia, which means difficulty with balance and coordination. By the way, I'm Dr. Air, quadruple board-certified psychiatrist and anxiety expert. Don't forget to subscribe for more insights on anxiety. Number 4, lemon balm. Lemon balm acts by blocking a brain enzyme that breaks down GABA. GABA is a chemical messenger in your brain that tells your nerve cells to calm down and relax, kind of like a stop signal that keeps your brain from getting too amped up. This effect increases GABA in your brain, which helps to calm your nervous system and reduce anxiety. One advantage of lemon balm is that it calms you down without causing brain fog. Dosing recommendations for lemon balm typically range from 300 to 600 milligrams of standardized extract for acute effects or 700 milligrams twice daily for chronic use. Studies show that lemon balm is helpful for anxiety, stress, and depression, and for improving memory performance. No serious side effects have been reported, though lemon balm may increase the effects of CNS depressants like benzodiazepines, opioids, and alcohol. It may also interact with thyroid medications. Before we go further, please know that this video is not medical advice. These are educational insights based on current research. Please work with your own doctor before starting any supplements. This is part 2 of a 2-part series. In part 1, I talked about 5 other fascinating supplements for anxiety. Number 3, valerian root. Valerian root is one of the most widely used and studied herbal sleep supplements worldwide. Many studies consistently identify valerian as among the most frequently researched plant extracts for sleep disturbances alongside melatonin and lavender. Valerian contains valerianic acid, which also acts on GABA, your brain's braking system. A 2006 study in the American Journal of Medicine found that valerian produces meaningful improvement in sleep quality without significant side effects. When looking for supplements, it is important to check for standardized valerianic acid on the label. Research studies used 400 to 600 milligrams taken 1 hour before bed. It is also essential to use it cyclically, 4 to 6 weeks on, then a break. This is because tolerance builds with extended nightly use. Now, when you take that break from valerian, here's something worth considering: melatonin. I want to be clear about something though. Melatonin is not an anxiety medication. But here's the thing. If you're not sleeping, your anxiety will not get better. Sleep deprivation is one of the most powerful triggers for a dysregulated nervous system. When you fix your sleep, you give your brain the chance to recover. Think of it this way. Anxiety and poor sleep are caught in a vicious loop. Anxiety keeps you awake. Poor sleep makes your anxiety worse the next day. Round and round it goes. Melatonin can help you break that cycle, not by treating the anxiety directly, but by restoring the sleep that your nervous system desperately needs to repair itself overnight. So what exactly is melatonin? It's a neurohormone, a chemical signal produced naturally by your pineal gland, a tiny structure deep in your brain. Your body starts releasing it as the day gets darker and night approaches. That release is your brain's way of saying, it's time to wind down. Melatonin secretion peaks between 2 and 4 a.m. and returns to low or undetectable levels by morning. But here's the problem for many anxious adults. Screens, artificial light, late night stress, and cortisol dysregulation all suppress melatonin production. Your brain never fully gets the time to rest signal, so you lie in bed wide with your nervous system still running at full speed. Melatonin works by binding to specific regions in your brain that help initiate and sustain sleep. Research also shows that melatonin may enhance the calming effect of GABA, your brain's primary braking chemical. So there is a connection with anxiety even though it may be indirect. Melatonin helps people fall asleep faster, increases total sleep time, and resets the sleep-wake rhythm. When it comes to dosing, research-supported doses are 3 to 5 milligrams taken by mouth, 3 to 4 hours before your intended sleep time, over a 4-week period. Side effects of melatonin are uncommon but can include headaches, nausea, diarrhea, vivid dreams or nightmares, and some daytime drowsiness if the dose or timing is off. This is usually resolved by adjusting when and how much you take. So here's the practical takeaway. When you're cycling off Valerian, which you should do every 4 to 6 weeks, consider transitioning to melatonin during that break if you struggle with sleep. And if you want a deeper dive into how sleep affects anxiety, I have a free sleep guide you can download in the description below. Number 2, chamomile. Chamomile's active compound is Apigenin. Apigenin binds to GABA receptors similarly to benzodiazepines, but not as strongly. In a 26-week study, standardized chamomile extract significantly reduced symptoms of generalized anxiety disorder. But the follow-up data is just as important. Patients who continued to take chamomile had a lower relapse rate than those who stopped. The studies for generalized anxiety disorder used pharmaceutical-grade chamomile extract at 1,500 milligrams a day, 500 milligram capsules 3 times daily, standardized to 1.2% Apigenin content. This herb is generally well tolerated with minimal side effects. Now, number 1, lavender. Set aside everything you associate with lavender, the candle, the bath oil, none of that is what I'm talking about. I'm referring to Silexan, a pharmaceutical-grade lavender oil extract with more rigorous clinical testing behind it than most supplements you will ever hear discussed. In a study, Silexan at 80 milligrams daily performed comparatively to lorazepam for generalized anxiety disorder. Lorazepam is a prescription benzodiazepine. A lavender extract, head-to-head, with a prescription benzo, no dependency, no withdrawal, no risk of falls, no memory problems, unlike with lorazepam. That's a big deal. Silexan's primary compounds are linalool and linalool acetate. These help your brain's calming chemicals work better so your body feels less tense and worried. Silexan has a favorable side effect profile. If any, the commonly reported side effects include burping and mild stomach discomfort. Antidepressants and other anti-anxiety medications can cause side effects like dependence, abuse potential, withdrawal, sexual dysfunction, weight gain, and increased fall risk. Silexan is not associated with such side effects. Drug interactions are also minimal. This is an advantage over many conventional psychiatric medications. Silexan's safety profile makes it suitable for patients who cannot tolerate or wish to avoid the side effects of benzodiazepines or SSRIs. In the next video, I discuss Silexan dosing, how to find genuine Silexan, how best to take it for anxiety, and a few other things you must know before you start taking it.